Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Hey, welcome everybody, and it's time for another edition of For the Health of It, Cowley County. I'm Tom Langer, the Health Department Administrator and Local Public Health Officer, and with me today, as always, is my assistant, Allie. Allie, how are you doing today?
I'm doing okay.
Great.
Thank you.
We've got a wonderful guest here with us today, and as always, Dan, the audio man, is making sure that we have a good quality recording so that you all can enjoy this at your leisure. So today, well, wait a minute. Before we start today, there's been a lot that's happened since the last time we've been on.
Yeah.
We went through and we had, of course, the Health and Safety Fair, which we talked about, which really was a good success again this year. And we've now completed the survey that we were doing for health.
Health counts.
The Health Count survey, which, Allie, do you remember how many?
There were just shy of 1,900 responses.
1,900?
Yeah, that's fantastic. Households.
Yeah, households. So, that really does represent, at least twice the number of people in most cases. So that's going to be really good. We're waiting for the data to come back to that. And then right after this, we'll be starting with the
focus groups.
Focus group meetings.
Later
and that's going to be in July and into the first part of August. This is all a long, drawn-out process, it seems like, but it's so important as we create our community health needs assessment, and then, of course, the community health improvement plan that, is what comes out of all of this work. So lots going on still. That's kind of why we've been busy working with those things, and now we're getting back into our podcast recording time, and we're really pleased today because we have guests with us. Nobody wants to hear me talk the entire time. And our guest today is Aimee Fowler. And Aimee, you are with an organization that's called NAMI. Is that correct?
I am, yes.
Yeah, and so what we're going to do is ask you a bunch of questions. And we want you to tell us and the community everything there is about NAMI. To start out, tell us a little bit about yourself.
Well, I live here in Winfield.
Okay.
This is just a part-time gig that I do with the National Alliance on Mental Illness, which is what NAMI stands for. I also work for the school district in our city, and I go to grad school. I've got a couple of kids. I'm very busy.
Sure, it sounds like you have all kinds of free time, but we're going to focus today on exactly what NAMI is all about and why it's important in our community and the people it serves and everything else. Allie, you have some questions. I know you've got bullet points over there on your list.
Yeah, you can just go ahead and get started by giving us an overview of NAMI, and we can go from there.
Sounds good. Yeah. So again, NAMI stands for the National Alliance on Mental Illness, and it's a grassroots organization that offers things like educational programming, support groups, other resources online. They have their own podcast on the National NAMI website. They do a lot for advocacy. You will see them at every advocacy day at the Capitol regarding mental health, as well as just advocacy in general.
What exactly does NAMI do in our community?
In our community, currently we have an active support group that, it's in partnership with Southwest Kansas NAMI. So on the third Tuesday of, it would be tonight, but third Tuesday of every month, we have an online support group that we do. And really that's about all we've got in place right now. As far as NAMI goes, it's all volunteer-based and membership-based, so got to get members on board, got to get the word out there to get those volunteers on board to offer more of those programmings.
How was NAMI founded? I mean, how did this come to be?
It was founded in the early 70s by basically a group of families who had some kiddos who had mental health conditions that they couldn't find services for, that they were really struggling to find programming and services to support not just their kids, but themselves as well. And that is how I myself stumbled upon NAMI a year ago. I was looking for services and whatnot because I have a kiddo who has some mental health issues.
So really this truthfully is grassroots?
It is, yes. Okay, it's a grassroots organization.
So it is family or individual helping other individuals. It's kind of like peer-to-peer?
Yes.
Would that be correct?
that is actually what one of our programs is called, peer-to-peer.
Peer-to-peer. Now,
Yeah.
We talked just a moment ago about the fact that we're doing all of the assessment work and everything in the county. And I know during the last 2 cycles, because we do it every 3 years, number 1 or number 2 on both the last 2 cycles, as far as the greatest concerns that we had were mental health,
Yep.
well-being, and health care connected with all of the various realms of mental health, and how difficult it is to find that, how hard it is to find perhaps even providers, trained providers in our community that can assist, and the lack of that. So one of the other things that about this topic that we really want to help promote is the help me out.
Stigmatization.
Yes, thank you.
You're
Stigmatization.
welcome.
My tongue is tripping there.
It's a hard, it's a hard word.
When you put the D in front of the stigma, it's in other words, taking the negative aspects or the connotation out of that. We all know what it's like to have to take care of our health, and for so long we've just considered that being the body. How we, eat, exercise, take care of ourselves when we get sick, how do we prevent sickness. But a lot of times we forget about, what goes on between the ears. And without that, you don't really have health.
No.
Not in the way it should be, right?
Right.
So we realize that, and I don't know that there's anybody who, in all honesty, is walking around today that can say that they have not been affected, especially within the last 4 or 5 years. If you survived the pandemic, which we've done, congratulations. You went through a time period of great and prolonged mental distress, and it has affected all of us. What we want to make sure is that we don't just have people pull the ostrich move where they stick their head in the sand and hide or avoid it, but that they basically can come to grips that, today in our world, in our society, taking care of our mental health is as important, if not maybe even more important sometimes, than our physical health, because without the two in balance, we cannot really truly achieve, our maximum potential or our maximum health.
Absolutely.
So,
Yeah. Well, if your brain goes
Yeah.
haywire, then your body follows.
So is there a specific group or cohort of folks that NAMI seeks out or is looking to connect with or serve?
Most of our programming is designed for 18 plus.
Okay.
We do have a NAMI basics education class, which is more for it's for the caregivers of kiddos who are under 18, and that's actually available on demand online through NAMI national website.
Okay.
Otherwise, it's really geared towards adults, but not.
And so,
specific.
you mentioned you have your story and how you got drawn into it. I imagine most people do. Tell us a little bit about the need that you have witnessed or that you've seen in our community.
Sure, that is something that NAMI loves to do. That's really what they do, is share your story. And my story is that we moved here in May of 2020. What a great time to move!
Oh boy!
we moved here from the Manhattan area, and my daughter, who has since been diagnosed with autism, she's now 18, but she was 14 at the time and was not diagnosed at that time, and we were having a lot of pretty significant mental health concerns as a result of having autism and not being diagnosed, and going through a lot of that social peer stuff, and it was a big mess.
I imagine it was great anxiety for everyone.
It was not a great time for any of us, for sure. But we moved down here, and the wait lists for therapy down here, aside from Fort County, who is great, they do what they can with the resources that they have.
Right.
But is over a year.
Yeah.
So
what do you do? Yeah.
Ultimately, for me, I have the privilege that my mother lives in Lawrence. So that is where my daughter ended up going to live, because she was afforded services there that were not available here.
Sure. Yeah, but still, you had to deal with this. I mean,
Yes.
you how do you not? And so as a parent, you see your child struggle, and then you struggle as well, and who do you turn to? So how did you end up finding out about NAMI?
About a year ago, I was just online looking. Actually, I was looking for just some part-time summer work because, as again, I work for the school district, so I have the summers off. So I'm like, I got ADHD. I'm climbing the walls after about 5 days of being at home. So I'm like, I'll find something to do part-time, and I happened to stumble upon a job listing for the South Central Kansas NAMI development coordinator. And I was like, what is NAMI? I don't even know what this is. So, I'm doing all the research, I'm Googling, and I was like, man, I really wish that I'd known that this existed 3 years ago when I was going through all of that stuff with my kid, because I could have been a part of a support group, or, I could have had access to some of these educational courses that would have maybe at least made things better for me and maybe my kid too, and maybe things would have looked different. But anyways, I applied for it because why not, and interviewed for it, and here I am a year later.
Aimee, we talk about the stigma of mental health and how people seem to even still. I'm a boomer, and there's no doubt about it. And so I grew up in a time period where you didn't talk about that kind of stuff. It was no, quiet. You could be you could be addicted to alcohol or drugs or any number of things. Now everything that was fine. You could talk about this. But if you were a little off, you didn't talk about Uncle Tom over there because he's just a little bit off. And it's sad because it seems like that hangs on even still today. And it doesn't need to, and it shouldn't. Do you find in your peer group, with families or individuals whose families are affected, that they still are having a difficult time dealing with the concept that, oh my goodness, my child has helped or needs help that I don't understand or I can't provide for them? How do they go about connecting with you?
I think once they find themselves in a support group, they have moved past some of that.
Okay.
But I will say that I have done some tabling events. Like I went over to Sumner County a month or so ago, and I did their health fair. And I had all my stuff, and I did have an older lady come up, and she was looking at all the things, and I was trying to chat with her. I always try to chat with everybody, and some of the stories that you hear from people when you are doing those events are really pretty profound. But she just kept looking, and I was just eventually, because you can always tell that someone, but they don't know. And so I'm just like inching my card slowly at her. It's like, you can, my number's right here.
Yeah,
but those are the people you really want to reach, but you can't, not until they're ready.
Right.
So best you can do is slowly slide your card at them and hope they take it.
I almost, I think I know the answer to the next question I'm going to ask, but have you seen the demand moving upwards since you've been involved, as far as, people seeking help or wanting to connect?
Yes, definitely. I actually tabled at the Bluegrass Festival last year.
Okay.
And so many people came up, and most of them just wanted to sit and talk and share their stories. And it was just definitely notice a large uptick in people just wanting to connect. We didn't connect for over 2 years with anybody.
Right.
Other than our household members, who I'm sure we all got sick of very quickly. But
does it, what does a person experience when they join a peer group or something like that? I mean, what's the process? Let's say I have a need that I want to talk. Maybe it's not about myself. Okay. Sure. Maybe my assistant here has got a problem, and I'm trying to help cope, but I have to understand. So, I mean, what's the person that would become involved? with NAMI and with the groups. What's that person like, or what do they go
Those
through?
people are all trained facilitators, and they're all, I mean, we're all peer facilitators. So
Okay.
we are peers in whatever it is that we're doing, be it a peer connections group, which would be those individuals who have history with mental health conditions, and then those peers are facilitating those groups. And
Okay.
then same goes for the family to family support group. So myself and my partner in crime, Eitzel, she's with Southwest Kansas. She and I are the co-facilitators of this support group that is on the third Thursday
Okay.
of every month at 6 p.m. to 8:30, or I'm sorry, 7:30.
So what are they, is it like a call, or is it like a Zoom
It's
call?
a Zoom. It's a Zoom.
Okay.
And historically, they have been done in person as well. And of course, I would love to get an in-person
Sure.
group started. You know, I would love to have one in every community, but you got to have the facilitators and the people to do that, which means you got to get those people on board, and you've got to get them trained and be willing to do that.
Sure.
So,
Okay.
but if you go to namikansas.org, they actually have a calendar tab link,
Okay.
and it will show you every support group and educational course that is happening anywhere in the state on any given day.
So there are
And you can-
various topics,
Yes.
or
No, they're
What-
so the support groups. It's run the same way every time. There's a PowerPoint, and you start with your rules and your introductions, and then everybody has a couple of minutes to kind of talk about what's going on immediately
with them.
yeah, with them, and then after that, you kind of just go into like a deeper dive for individuals who need a deeper dive. And really, it's just a connection. And the facilitators, might offer advice or support from our own experiences, but none of us are therapists. We
But
don't.
this is, and excuse my ignorance on this,
Sure.
because I really don't know. So the questions I ask, I'm trying to better get my mind wrapped around, what an individual why they would reach out, why they would seek that. I mean, they may have an issue, or they've got a family member that has the issue, and they're affected by that.
Mm-hmm.
I think of I mentioned earlier, addiction groups. You think of like, Alcoholics
AA,
Anonymous,
yep,
or things like that. And so is it structured similar to that, or no? I mean, I'm trying to paint a picture with words so that
Sure.
people understand what
And I've never
what
been
happened.
to an AA group, so
Sure.
I don't know what
Yeah, okay.
that structure would look like. Really, these support groups are really about just connecting with others who have this shared experience of being a caregiver or a loved one of someone who has a mental health condition.
and so it's basically it's that person to person support that, hey, you're not alone.
Absolutely.
You've got somebody you can talk to, something like that.
Yes.
Is that right?
Yep.
I
That's
want to make
100%
sure.
it.
I want to make
Yep.
sure that I'm coming out of this, and really understanding. Now, here's a question: does it cost people anything?
It does not. You do
Okay.
not have to be a member to attend a meeting. Of course, we encourage membership, and it's a whole $5 for a year to
Okay.
become a member. Some of that money goes to the individual affiliate. Some of that money, of course, then goes to the statewide, and it helps support and pay for all of my really cool brochures and all of those other needs, because not everything is free. I mean, even
Sure.
free groups cost
There's a
something.
cost.
There's a
Yep.
cost to that. It helps support some of those things.
How do people connect with NAMI if they're listening to this and they say, they're talking about me here? How do they reach out? And I mean, you mentioned the website, right? Was it NAMI Kansas?
NAMIKansas.org.
All spelled out, okay, .org, so they can go there, right? And I'm sure that we're going to get your contact
And then,
information.
yep, I've got an email, and I serve, and we added several counties recently, which is why I have my card to remind myself which ones I serve right now. Butler, Greenwood, Elk, Sumner, and Cowley are under my personal umbrella
Okay.
right now.
And is there more than one group, or that you just talked about the third Thursday
That's
group?
the only group we have running right now.
Okay.
Again, I have so much spare time on my hands. So the once a month is
Yeah.
all I can personally do. And we've got, I think, 7 members with our affiliate as a whole right now. And our chair lives in Sumner County, and she's really, really, really active in all sorts of things. But as far as support groups and education classes, that's all we've got right now.
You mentioned that NAMI is primarily run by volunteers.
Mm-hmm.
So how would somebody get involved if they wanted to be a volunteer, and what might it be that they would be doing to help this initiative?
At going on to namikansas.org, and you follow, I think it's at the top right, there's a tab that says Become a Member, and you pay your $5 or more if you so choose to do so. You get a wonderful welcome email from myself that lays out in details some of those things that are available to become involved, and you get information on our monthly affiliate meeting that our wonderful chair, Lori Barnes, out of Sumner County, runs, and we go from there.
Now, here's something I think that I would want to know. If I'm affected somehow, and I'm like, I've never had something like this occur before, and I bewildered, and I'm frustrated, or and I want to learn more, or I may need even like a referral or something like that. Does this group, does NAMI provide that type of background or information for people? Because you talked about how you struggled with your child, mm-hmm. and you had to know, you had to have a diagnosis, and yet the challenges that we see with mental health providers, that you can't get in, or you don't even know the questions to ask, right? So that, to me, it would seem like, we talk about this on the public health side. We know what our products are, what they do, how to do that. We can connect with caregivers, in our community, hospitals, physicians, clinics, and all of that, to provide that acute health care while we do a lot of the preventative stuff. But for many of us, the concept of the mental health, we try. We know that it's a challenge, or that it's a growing concern and problem. Having lived through the pandemic, let me tell you, I know personally the toll it took on me, having to deal with everything that was going on, and the not just dealing with the issues that I could control, but the stuff that I couldn't, and then all of the background noise and all of the social stressors. That is why in my profession, in the state of Kansas, over half of the people that did the work that I do resigned, because it was just too stressful, and you had to really have the fortitude to muster through. And I'll tell you what, I remember, I'll share this with you. I mean, I remember that time period where I did not know what day it was. And it didn't matter. It was, the sun was up, we were here working. The sun went down, you tried to get a little rest, the sun was up, you're doing it again. It didn't matter. I had no idea. I think back on 2020 and 2021, where we really, were lined up outside, and we had testing lanes that ran for 8, 9, 10 city blocks long, and out there, no matter what the weather, every single day, testing, providing vaccinations, all of the stuff that went on to it. It just, the days, it didn't matter. Even when I look back on it now, I'm like, I don't even remember what happened. It wasn't like a normal summer. It wasn't a fall. It was just that blur, that everything just, went from one to the other. And we talked about this not too long ago. I says, gosh, think about what we've been through and where we were just a couple of years ago, and how things have again changed. And thankfully, because something like that you cannot sustain for long periods of
No,
time.
for sure not.
We've always been trained in public health to respond to health emergencies, but they are generally of short duration. You think about the tragedies that might occur with severe weather, storms, floods, that kind of stuff, or even an outbreak, but not something that lasts for years. We can go in, we can pick up pieces, and we can get moving again. But those things that are long like that, they are so draining on a person psychologically, I think, that it also led to a lot of health issues. I mean, physical health issues.
Absolutely.
So, anyway, that's why I say we all have it. And anybody that's lived through this now, they know exactly what we're
Absolutely.
talking about. So,
Well, to sort of answer what I think your question
Yeah.
was,
whoa, I got off on you. I mean, get the couch and let me just talk to the doc here. I don't know. But,
I do keep I have a big, giant document for every county. Well, I mean, Cowley County is my biggest document just because of resources, and it's not just mental health resources. I have resources for housing and clothing and food.
Right.
I keep all of those resources that I can give to people as needed when and if they contact me and need that. And I have that for every county,
and
which
you
is
should
handy.
be on ours too, I would think. Because, I mean, we talk about Rise Cali, the coalition,
Oh, yeah.
and you know
Yep,
about them.
yep.
And I think, I hope that you're on that resource list. If not,
I'm gonna check it out.
Look,
for not,
yeah,
we're
we'll
gonna
have to
make,
check
we
that
have to
out.
make,
I'm
we have
gonna
to make those
look-
connections and make
look
sure
into
that you're
that.
Yeah,
out there.
for sure.
Because I think that's really exceptionally important.
But as far as like sending referrals to, again, I'm not licensed. I can't do any of that. But I can point people in the right direction to try to get those resources and really advocate for yourself. It's a lot of work. And even as educated as I am, it was a lot of work
Yeah.
when I was trying to do that for my kid a few years ago. So
Oh,
I can't
I
even
can
imagine
Wow.
people who don't have even the background that I have trying to navigate all of that. But that's why I'm here and have those resources.
I think, like I say, it is so very important, and it seems to be more and more. And then these issues can happen at any time in a person's life.
Absolutely.
I think that's
To
another.
any person.
To anybody.
Absolutely.
Yeah.
Yep. Well, and just would probably be a good time to plug the crisis line to 988, that crisis line to text or call 988 if you are in crisis or suicidal, etc.
I know a lot of times, because we've seen that with suicide prevention, efforts, that it's sometimes it's sad to think that we have to get that far, that we're looking
I agree.
we're looking into that dark of a hole
I
for us
100% agree
to
with that.
to make a call or something. And so to me it's again, it's kind of like what we do preventative. I'm like, how do we change our attitudes and our perception to know that we've got to check everything out. We go in and we have a physical, but how often do we talk to somebody, or that's trained, that can help us with any other troubles that we may be having? And I think everybody has them nowadays. And the more we get into this connected age, I talk about being a boomer, and I've seen everything, where the rotary phone and the pad on the wall that we kept, our messages on, to now stuff that we can't get, seems out of our hands. I just look at kids today, especially, and the pressures that they have from this always on, always connected society, and it's really frightening. It is.
I agree. Yeah. Well, we all saw that. Anyone who attended the data walk and saw those stats for middle school and high school kiddos, it was
Oh yeah, the
Pretty-
suicidal ideations
pretty alarming.
And we've had the folks on from Eric was on
He was on talking about Hope Squad.
Hope
but
Squad. Thank you. Yeah.
Suicide prevention
Yeah,
in
see,
Cowley
I'm
County.
I'm getting old.
Yeah.
It's right there, and I'm like,
Yeah.
what was it? Hope Squad.
Well, and NAMI has something similar to Hope Squad that they actually just rolled out. That NAMI on campus is what it's called. And of course, we have Hope Squad in all of our schools in our area, but which is similar. I think NAMI really expands on that to encompass all of mental health and mental illness, as opposed to Hope Squad, which really kind of focuses in on the suicide
prevention,
stuff. They did recently roll that out. I think it was last fall. So that they're trying
Like
to
say,
bring those into schools. Because really that's what it is. It all boils down to education and the destigmatization
Right.
of it all.
Yeah, when you feel comfortable enough talking about it,
Yeah.
and we realize you're not alone,
Yep.
then that even of itself is an enormous burden that can be lifted off of a person.
Or
So-
even just being young and learning how to cope with things.
Yeah.
Yeah.
So that you can
absolutely.
use those skills when you're an adult and encounter things that suck.
Yeah, and it does.
For
I mean,
sure.
those things don't and they come along and say, and they'll hit you from when you least expect it. It seems like we've talked a little bit about support, and you talk about dues, and so people can sign up. But are there other things that NAMI does? Chapter wise or something like that, fundraising events or awareness building events?
They do a NAMI Walks event every year at the state level. That happened back in May. That actually happened the same weekend my kid graduated, so I didn't make it. But they do that. Individually, like at the affiliate level, we do have a fundraising event coming up. In Sumner County, we're going to be part of the fair.
Okay.
In Sumner County will be. So, I mean, I'm still learning how to do all of that stuff. Like, I don't have a whole lot of experience as far as your grant funding goes and doing all of that.
Well, it sounds like if you guys participate in all those different advocacy events, that there'd be lots of opportunities for you to be seen.
Yeah, because I know there's the cost. You talk about $5 a year. That's people spend that on a cup of coffee now. You think about it.
At least that. I think
and it's and
my
it would-
last cup of coffee
it would
that I got
just
fancy was over that even, and I think it was a small.
yeah, and it's just one of those kinds of things where I would hope that there would be an outpouring probably of sorts if people knew how they could perhaps help. Some people think, well, the best way to help is here, let me write a check. Other people will say, oh gosh, I want to be involved, and having those avenues available for all the different types of people
Absolutely.
that want to assist. So we really want to make sure that we help you promote this through the podcast.
Absolutely.
I very seldom
appreciate
go out.
that.
I very seldom go out there and say, "Hey, folks, dig into your pocket and give something." But I think this is probably the most underrepresented and underserved and undersupported parts of preventative health care that we face in America and here in our county. And so to me, it's like, what's the call to action? How do we do that? How do we get people involved? Not just if they have a concern or they need help, but for those of us who say, gosh, we are blessed that we don't have that, but it could be us at any point in time. And so how do we prepare for that? We buy insurance, we have all this other stuff, but if I fall down out here and I grasp my chest, my staff is trained to grab the AED and shock me and get me to the hospital, and they'll get me a cardiologist. But if I break down, snap or something, nobody knows what to do. They're going to look and say, what's wrong with him? And I think that's the sad part of it. We just have not taken the time as people or as a society to look at this and say, what are the steps that we take? How do we do this without being offensive, without being mean, without being cruel? And how can we be compassionate to somebody else to help? Because I think that's what it's all about.
Absolutely. And this is not NAMI related, but are you familiar with mental health first aid?
Before the pandemic, we were really pushing it. We were getting in the community. We were having folks go and get the training and all of that, and then all of a sudden we had kind of a derail.
Yeah.
And so it's we have so many things that we're trying to bring back online again and get going, but it's those are things that I think are so very important. We talk about just the importance of kind words in a cold society, where people say, everybody's angry all the time, everybody's just so hateful, and it's like, well, that starts with one person that you can change it to be upbeat, to smile, and to truthfully ask somebody, how are you, and to take the time to listen. I mean, I don't know how many times we use that just as a passing greeting. How you doing today? And you're telling me, and I'm like, I'm already gone, but you pause for a moment and listen,
Yeah.
and a smile for somebody, that you don't know, a stranger. It means the world to so many people, and what it can do for them mentally, I think, is important. So, tell us again, how do folks reach out? How do they contact you, Aimee? How can they find out more? We've got the website information. We'll put that in the links.
Yep.
We've got a number. You want to go ahead and read it off? You can.
You can
Yeah.
email me directly at Aimee@NAMIKansas.org, and it's AIMEE at NAMIKansas.org. And then my phone number is 785-214-4488 is my direct line, which it doesn't always ring because it's like that weird
Sure.
app. So, but if you leave a voicemail or you can text it, I will definitely get to it as soon as I see it.
If there's anything that you would want our listeners to hear about mental health, what would it be?
What would it be? Oh man, that's a loaded, difficult question. It's not abnormal. And we all experience stuff. We all go through stuff, and none of us should be ashamed of it. And we should all be out there speaking our truth so that other people feel safe to do so too.
Yeah, I think that's probably the big thing. I don't know anybody that hasn't had challenges and trying times. You know, we come from a culture, agricultural based in Kansas, and a lot of that is still stuck with us. And you know, it's incredible to find that people that are farmers struggle so much in silence because we were brought up to be tough, and how sometimes that can backfire on us.
Every year we all meet in Topeka for basically a statewide conference, and last year one of the panelists was a farmer, and I don't think he was from our region, but he was a farmer in Kansas, and he talked a lot about his struggles and stuff, and it was really very impactful because it's coming from a person who you look at and you don't expect to be willing to share that kind of stuff, and it was really very meaningful to listen to.
Feast and famine cycles, and it's always highs and lows all the time, and things you cannot control, but yet you struggle with, and I think that kind of does it. So, anything else? I mean, this is kind of a sobering thing, but it's a topic I think we need to. I hope people can feel encouraged to talk more about. Maybe just sometimes, you know, at home, opening up with each other and like people, let them know, you know, I'm having a day today, you know, and it's not just because I got angry at work or something or somebody, but you know, you struggle.
Things feel off.
Yeah,
and sometimes they feel off without reason.
To acknowledge those things, and to be able to reach out and find some help or some supporting voices, I think it's important, especially, like I say, as we isolate ourselves more and more on these things being the phones, you know. So anyhow, Aimee, final thoughts at all?
Thank you.
You know, thank you for
appreciate your
thank you
time.
for taking the time out. I know you got a lot of brochures. Do we have copies of, or any of these things that we can keep in the health department so that if people were wanting to know?
That's why I brought my box in.
Okay, so
Perfect.
We'll check.
We'll make it happen.
We'll make that happen after this goes on, and we'll. I know this one we're recording today, and it'll be out in a couple of weeks, I think. So that we'll publish it. Just so you know, there's always that time lag, and when we get it up and running, we're going to shoot you an email, make sure you know that it is, and we'll help you get it spread out to as many folks as we can. So, Aimee, thank you so very much for coming in and talking with us about this today. I've enjoyed the conversation. I agree. Everybody is affected by this. All of us are. And for people to sit there and say, no, you're not, I'm sorry, that's a lie. That's just a truth that's maybe yours, but it's not reality.
Absolutely.
And so that's the more we can come to grips with that, I think the better we can all be health-wise. So anything else to offer?
Not today.
No? Then all right. Then until next time, we hope you all stay safe, and we hope you
Stay well.
stay well. Thank you.
Thank you.
Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. Going for a dip at the pool is one of the best ways to beat the heat during those hot summer days, but this can also present its fair share of hazards. Here's your local health department with a few tips to keep you safe by the pool. First and foremost, learn to swim. Lessons are available for all ages and skill levels, so make sure you have the skills before you enter the water. Second, avoid swimming alone. It only takes a few minutes for drowning to occur, so having someone nearby, especially a lifeguard, can mean the difference between life and death. Next, if you're taking your kids to the pool, give them your undivided attention. Children can drown in a matter of seconds, so put the phone away and remember that distractions can quickly turn into tragedies. Lastly, know your limits. If you're not confident in your swimming skills, avoid the deep end and stay out of any waters that may be beyond your skill level. Helping you keep safe by the pool is just one more way the health department works hard every day to help you stay well.